Hi, my name's Julie, and I'm one of the nurses here at Dr. Barone's office in EVOLV Medical Aesthetics. I started in November of 2015 and have become more and more active in the practice, which is very exciting. So I help Dr. Barone with office hours, taking care of patients, and I also see patients on my own. There's a few different procedures that I do in the office. One of them in particular is Infini, which is our microneedling with radiofrequency technology, and that can be used for scarring, improvement of texture, tightening, those sorts of things with the skin. I also do injectables, so that equates to neuromodulators, which are Botox, Xeomin, or Dysport. And I also work with the different fillers that we offer, and we have 3 different companies that we get fillers from: Allergan, MERS, and Galderma. So there are a wide variety of those things. So I do see patients on my own as well. My favorite part about being in this practice is that we really get to know our patients. We get to know them personally and professionally, and we develop a relationship with them. I've always wanted to be in a medical position where I had the opportunity to do that, because I think in many medical offices, you don't. You are only seeing people when they're ill. And so you don't have the chance to establish a lifelong relationship, which is really what we're doing here. And I think it's an amazing opportunity. The really fantastic thing about our patients is sometimes they may come to us because they're in a crisis part of their life. Oftentimes with breast cancer women, we will see them when they're just working on, we may see them right when they get diagnosed. And then Dr. Barone is working with another surgeon on developing a plan about how they will be reconstructed. So we'll help and be with them through that entire process. But oftentimes those patients turn into skincare patients. So they continue to come back and see us and let us be a part of their life, in the long run, which is really fantastic. And so many of our cosmetic patients, they may come in because they want to have liposuction or have a facelift, but then we see them for years, because not only do we want to have them have an amazing result, we want to help them maintain it. So we really enjoy those relationships. Our patients tend to continue to come back. Not only we build a program for them if they are going to have a cosmetic surgical procedure with us. It's a very well laid out plan they will have a massage before surgery, not necessarily, it wouldn't be that day, but plausibly the day before, whatever works for their schedule, that helps to ease anxiety. And we want people to be as relaxed and excited and comfortable with the decision that they've made going into surgery. Following that, we have manual lymphatic drainage massages, which help with healing. It's a very easy way to talk about it, before they see him post-operatively. And that is all based on whatever procedure the patient is having done. So not only are our patients seeing the clinical staff, but they're also seeing the aesthetic staff from the very beginning. So I think it makes it very easy for everyone to become involved. And so these people all become part of our family, and we see them continuously. They get to know their providers, and I think it really enhances the experience. We have one patient in particular that says he just likes to come to the office, and he feels like he needs to have more things done because he wants to be able to come to the office more. And I try to tell him, you can come see us. We're always happy to see you, and do some skincare, So those are some really fantastic things. And we do have long-standing patients who, say a breast cancer patient has come in and gone through that process, and they were so overwhelmed with the care and the support that they felt coming to our practice that they do come back. And it's almost like having a friend over, each time that they come for an appointment. And they're so excited to see us, and they're asking about our lives as providers, which is fantastic, and we know and care about their lives. So it's just a really good, heartwarming feeling to be able to create those relationships and continue on with them. So a patient who has maybe found us through our website or some sort of social media, if you're considering having an aesthetic procedure and you would like to have a cosmetic consult, is what we call them, with Dr. Barone, the ways you can prep for that are if you can outline anything that you would like to talk with him about and specifically kind of prioritize, because the cosmetic consult appointments can become very overwhelming. The point that we stress when you come in is that we want to educate you about all of your options and all of the opportunities that we have. And some people may have a huge plan. They want to do an entire body procedure. Some things have to be broken down into segments because you physically can't have that much work done at one point in time. And we want to build a plan with you so that you can prepare for it and you can feel like you're getting everything done in a stepwise manner that makes sense, that is going to be the best experience for you. So I think it's very important that you come to the appointment, have a list of questions, and again, that prioritization so that we can help you in the best way possible. So when you first come in and get actually into an exam room with part of our nursing staff, we're going to sit down and we're going to talk to you about what you're here to discuss with Dr. Barone. Because the other part of this process is that we as nursing staff are going to be your advocate. So I always want to gather as much information from our new patients and any patients in general before they even see Dr. Barone. So I think by having those conversations, we start to help people feel more comfortable. We're building relationships from the get-go so that by the time I might ask you if you're comfortable changing and getting you a gown, because we will have an evaluation that looks at what we need to look at, which is most likely your body, that you feel more comfortable with that. So that is really and truly how we're able to sort of transition into a place where people feel more comfortable. And so at that point in time, we would get a robe, which they're all nice and warm because they're in a warmer, which I think is also so wonderful, honestly. And then hand it to the patient and step out of the room and have them change. And then of course we'll knock and come back in and then continue to move forward. I think that by having someone in a robe already and then continuing your conversation with them in a very straightforward manner, that you're continuing to build a relationship which people trust you, so that by the time Dr. Barone is in the room, we're ready to go and everyone feels as comfortable as possible. And of course, coming to a doctor, you would hope that you would feel comfortable talking about whatever part of your body you needed to talk about.